want to give away $1.4 billion of free motherfucking money to the immigrants for health care. And if not, if the other side don't agree with it, they talking about shutting down the motherfucking government. Why the fuck do you bitches fight so hard for everybody but your own motherfucking people? I'm sorry, those folks weren't supposed to be here to begin with. I don't really give two flying fucks. What about us? What about us motherfuckers who struggle to pay for health care?
Yeah, a lot of you guys are saying that on the social medias here, and you're all wrong. Giving money and or free health care to undocumented immigrants is not what the Democrats are proposing. It's not too often that a legacy media outlet will just outright debunk a claim from one side or the other, but the New York Times in this case did, explaining the GOP's misleading talking point on the looming shutdown. This is what the Democrats are actually looking to do. The Democrats' budget proposal seeks to extend Affordable Care Act subsidies set to expire at the end of the year and roll back Medicaid cuts in the tax cut and domestic policy law signed by President Trump in July. But the proposal does not provide free health care for unauthorized immigrants.
Don't forget that the backbone for the conservative argument for why all of these different programs should be cut is the fact that they believe that if someone goes to a hospital and it's dying, but they're not a citizen of the United States, the hospital should turn them away. That's what they're asking or saying when they say that, oh, all of this money is being spent on emergency funds for illegal immigrants. That's because a long time ago, as Americans, we decided that if you went to the hospital, no matter what, we were going to do our best to fix you up and make you better. That's what healthcare meant in the United States.
So here's what's hilarious. They've been screaming about free healthcare for illegals for years, and it was never true. The ACA subsidies don't cover undocumented immigrants. Never did. That's just a fact. But now that their premiums are exploding, suddenly they're like, wait, maybe we do need government help with healthcare costs. The immigrant thing was always a distraction, a way to make you hate the wrong people while insurance companies picked your pockets. And the real kicker, the basic human decency of emergency care they're mad about, treating dying people regardless of citizenship. That's been law since the 80s, but facts don't matter when you need a villain, until you become the victim.
I don't think people realize the reason Europe has free healthcare, free college, all these other great benefits is because of America. Because of the United States allows you, well, not really allows, but lets you have the ability to have free healthcare and to have free education. It's all because of America. If America wasn't subsidizing you, sending all this money, completely funding your military, pretty much being your military, Europe just wouldn't have free healthcare. They wouldn't have a military. Europe would pretty much have nothing. So if America took back all their money, pretty much got out of NATO, whatever, Europe's free healthcare, free education, military, it would all collapse, but we'd have a lot more money for America. America would have free education, would have free healthcare. So maybe we need a switch up.
Oh, now they want to talk about how Europe has better healthcare? For years, it was Europe's a socialist hellhole, and they only have it because we defend them. But the second American premiums hit $800 per month, suddenly Europe's system looks pretty good, huh? Here's the truth they're discovering. Europe pays less in taxes plus healthcare than we pay in taxes plus premiums. They just figured out they've been getting scammed. Welcome to the realization, folks. Better late than bankrupt.
If you are an American and you don't want universal health care, I've only ever heard two reasons why. And that is, one, it's socialism, which if that's what you think, then you are too uneducated and too unintelligent to save. Number two is because people complain that countries that have universal health care have a higher tax rate than the United States, which if you look at it on paper, you're right. But if you just do the math, you're incredibly wrong. And so I'm just going to do the math for you so you don't have to. The average Denmark citizen makes about $55,000 a year, and they pay about $20,000 a year in taxes, which if you do the math, a 36% tax rate, but you have to remember that taxes is paying for a universal healthcare system, so Danish people do not have health insurance premiums that they have to pay. Now, if you look at America, the average income for an American citizen is $61,000, and the amount of taxes that they pay is $17,000. And the average American citizen is also paying $8,000 to $9,000 in health insurance premiums annually. Now, if you combine the taxes annually and the health insurance premiums annually, you get a rate of 42%, which if you remember not too long ago, the Danish people are paying 36% tax rate, and Americans with their tax rate plus their insurance premiums is 42%. So again, tell me how Europeans are paying more in taxes when they don't have to spend money on health insurance premiums. I'm waiting.
This is the moment the math breaks their brain. Denmark, 36% effective rate includes all healthcare. America, 28% taxes, plus 14% premiums equals 42%. We pay more, get less. And the people finally understanding this? MAGA voters watching their costs explode. For years they screamed, "I don't want socialism," while drowning in medical debt, rationing insulin, skipping checkups. But now their ideology smashed into reality at about 1/200 month. The insurance companies they defended are bleeding them dry. The socialist systems they mocked are cheaper. The politicians they elected voted to make it worse. And suddenly, universal healthcare doesn't sound so crazy. It's almost like the math was always there. You just had to be willing to look at it.
We are in very serious times here in Washington State, as many of you may be aware. The governor of California, the governor of Oregon, and the governor of our own Washington State has launched the West Coast Health Alliance. And what this is a regional partnership focused on delivering unified, science-based vaccine and public health guidance. This unifies all 3 states, and the key goals of this are as follows: issuing coordinated immunization recommendations grounded in national medical expertise, reaffirming commitment to science-driven public health decisions, respecting each state's autonomy and recognizing tribal sovereignty in delivering health services, developing shared principles in the coming weeks to strengthen public confidence, and the list goes on. If there's one thing we know, it's these left-wing political class officials love to use science as a weapon to control people, to manipulate those that disagree with them, and then to cater to those who keep voting for them. If we allow our imaginations to run wild and to see where this could play out and where it could land, this is extremely dangerous.
So we have a doctor who will not give an unmarried woman prenatal care. But I'm just going to guess that he is also pro-life, and he would also refuse to give this woman abortion. So in the same breath, using your religious beliefs to not support a woman in her pregnancy, but also force that woman to go through said pregnancy. Like, which is it? This is one of the reasons that when women reach out to me about being a single mom by choice and they would like advice, you need to not be in a red state. In this regime, I would be absolutely terrified to be an unmarried pregnant woman, or even just an unmarried woman with children in a red state.
I just want to say once again, for those in the back, undocumented immigrants are not eligible to buy healthcare coverage from the Affordable Care Act or Obamacare that the Democrats are trying to protect. They're not eligible. So take that off the table. Take it off your radar. It's a non-issue.
Say it one more time for the awakening MAGA voters. Immigrants aren't covered by ACA. The thing you're now begging to keep funded, it never went to undocumented people anyway. You got played. They invented a fake villain, made you angry, then voted to strip your coverage while you were distracted. And now you need it back. So yeah, maybe next time someone screams about immigrants stealing healthcare dollars, ask for proof, because you just learned the hard way. It was a lie.
Republicans voted to raise costs and take health care away from American citizens, including their own constituents. Play that back as many times as it takes. Our economic policy is right-wing. Our foreign policy is right-wing. Our high court is right-wing. Our media is right-wing. Y'all won, but still your life sucks. So now what?
I do think that there are some conservatives that just hate anything to do with healthcare in general. If it's not like woohoo functional medicine or homeopathic or whatever, they don't want anything to do with it. They don't think there should be any healthcare coverage. But I think the bigger problem is there is a really big block of conservatives, at least in the United States. I think you might be Canadian, so it could be different there, that genuinely have zero idea how the healthcare in the United States works. They seem to think that if you have a child with a disability, that, well, you'll be taken care of. They won't take the next step to research anything about how they vote actually affects people. And the amount of times I have to talk circles around people trying to explain to them that just because my child has a disability does not guarantee her Medicaid, how hard it is to qualify for anything that has to do with disability, how some states have waivers but most don't, how most parents will end up plummeting their families into poverty to qualify for Medicaid. like they think it's all waste, fraud, abuse. That's the tactic that they use now, right? They think, oh, I'm not cutting Medicaid for people who really need it. It's just waste, fraud, and abuse. And they don't realize that all the rules that are being in place push people off in situations like this. And then when they're in a situation like this, like we were about 10 years ago, suddenly you realize how it really works and how many half-truths you've been fed, and you're like shocked. And then you try to tell people about it, but the rhetoric is so strong, they won't listen to you.
This is the part where temporarily embarrassed millionaires meet reality. For years, conservative voters assumed safety nets were for other people. Lazy people, undeserving people, not them. Then their kid gets diagnosed, or they lose their job, or they retire and realize Medicare has gaps. And suddenly, all those wasteful programs they voted to cut, those were for people exactly like them. She's talking about parents with disabled kids having to literally impoverish themselves to qualify for Medicaid, about how people genuinely believe waste and fraud is the only thing being cut. But it's not. It's your neighbor, your family member, you. Conservative policy banks on one thing. Bad things happen to other people until they happen to you, and the system you dismantled can't save you.
The first time the state of Texas used a vigilante law to try to stop people in the state of Texas from having abortions was in 2021, before Dobbs, which overturned the longstanding law of the land, as they called it, of Roe versus Wade. Since then, they've continued to kind of use that same idea, including for what they call abortion trafficking laws, in which case in certain counties of Texas, someone can report you for traveling through that county to try to obtain an abortion elsewhere. The latest law they're trying to pass is now going to allow people in the state of Texas to sue healthcare providers from outside the state of Texas who prescribe abortion medications for people within the state of Texas. If this gets signed into law, which it seems it will, this would allow people who live in Texas to receive up to $100,000 from healthcare workers outside the state of Texas who are simply trying to help people within the state of Texas obtain the care they need. What I really struggle to reconcile is how people who come up with ideas like this in order to make sure that pregnant people cannot access health care will also be the same people who say that we should not mandate things like vaccines, which prevent illnesses and the spread of those illnesses, because they say they don't have a right to tell people to take vaccines. But they do feel they have a right to tell people they cannot access this specific type of medication or abortion procedures. And certainly none of this is pro-life, because pro-life measures would be wanting pregnant people to be able to access health care. It would be wanting people to have access to vaccines so they can remain healthy and not spread communicable diseases. That would include limiting access to firearms, which are the #1 cause of death for children in this country. But they're not doing any of that because they don't care about any of us.
Texas turned healthcare into bounty hunting. Private citizens can sue out-of-state doctors for prescribing abortion meds to Texans. Win the case? $100,000 reward. We're literally one step from wanted posters at pharmacies. And here's the hypocrisy. These same people scream medical freedom about vaccines. Government can't mandate health decisions, but forcing pregnancy, denying medication, prosecuting doctors, that's fine. If this were actually about life, they'd fund prenatal care, parental leave, childcare, healthcare for kids after birth. They don't. They vote against all of it. So what are we left with? Punishment for getting pregnant, forced birth, then abandonment. That's not pro-life. That's pro-control.
You Trump humpers are about to get us in World War III. You guys will do anything Bibi Netanyahu tells you to do. If he told you to jump off the bridge, you'd do it. You guys are so gullible and naive. And now we have these pundits like Tucker Carlson speaking sense for once, because it's gotten so bad. It's gotten so bad when Tucker Carlson is literally spewing facts and grilling Ted Cruz. That's how things are upside down. That's how if we're at the point of no return, people, and they said Biden was incompetent, and they said Biden was senile, and they said Biden had dementia. Did you see Donald Trump speaking what ago on the White House lawn? That guy looked defeated. He looked sick. He was slurring his words. He was sweaty. He's always sweating, but he had that stupid white hat on, the MAGA hat, which, let me tell you, how could he have any supporters at this point? You'd have to be a feckless lemming to still support him at this point. So we're gutting healthcare for millions of people. We are deporting people that weren't supposed to be deported. Not one thing has been done for the middle class, not one single thing. And then Bibi Netanyahu decides to start sending missiles because Iran's been developing a nuclear weapon. They've been developing a nuclear weapon to Bibi for 30 years. He's been saying this since like the 90s. They're just a day away, an hour away, a minute away from a nuclear weapon. They've been saying that shit for years. And we just keep getting lied to. And just enough with it already.
How do we live in a country where people work their whole lives and then can't afford health care? I just paid a patient's Medicare deductible. I'm not telling you that to brag, and I'm not telling you that because I'm a saint, because I'm definitely not. I'm telling you that because we live in a country where people can work their entire lives and retire and then have to choose between buying groceries and paying for their health care. There was absolutely no reason for me to be in that office. I'd already been in that office once, but I somehow forgot to drop off the orders I was in there to drop off. And so as I made my way back downstairs, I stopped in and there was a couple standing at the window, and the lady told them it was going to be $154, and the lady looked at her husband and she's like, "We don't have that." And the lady was like, "I'm so sorry, we can't see you. We'll have to reschedule." And I slipped around the corner and I was like, "Do not do that to them. Don't do that. I'll pay it. Don't tell them, but I'll go to my car and I'll come pay you." And so I went back up there. It was going to be 3 weeks before they could see a surgical patient again. We have to do better.
I just saw Hillary Clinton say that insurance premiums were going up for millions and millions of people because of that stupid big whatever act that was passed. I'm not sure I understand it. She said something about the ACA. He ended some credit that the insurance companies got for the ACA. And so insurance costs would be going up like 75% for millions of people. Is that possibly true? Is that true? She said this should be happening soon. Oh, God.
That's when the hidden policies fully activate. Work requirements for Medicaid sound reasonable until you see what they actually mean. Submit documentation proving you worked, but the agency loses it, you're kicked off. Now you're fighting bureaucracy while uninsured. Caregiver for a sick parent doesn't count as work, cut off. Gig worker, part-time, doesn't fit their definition, lose coverage. And the people this destroys most? Rural red states, the voters who elected these politicians. But they don't see it yet. They think they're cutting fraud. They think they'll be fine. They won't be. When grandma loses Medicare, when insulin gets cut off, when ERs turn people away, then they'll understand. But this person's warning you now, a year and 5 months. That's how long you have to prepare for the collapse.
You got a year and 5 months, man, to prepare for what's going to happen in 2027 when all these policies that Trump enacted in his big disgusting bill go into effect. Millions of people are going to get kicked off of Medicaid and Medicare. If you know, you know. People that are in these programs, they're probably going to get kicked out. The work requirements go into effect. So let's say you fulfill your work requirements and you submit the documentation to these government agencies and they lose it. You're kicked off. And then you're stuck in the bureaucratic pit of trying to get the shit back. Like, y'all really don't understand how bad this shit is about to get, man. The haves and the have-nots are really going to start to widen. That gap's going to start to widen. So you need to get your shit into order, man. A year and 5 months, man. If you know friends, family that rely on government assistance, it's going to get fucked up. So start planning, man, because this shit's coming.
They did it, finally. I knew this long time ago, like maybe nearly 2 years now, or at least, but I don't have a plan, an exit plan. How can I help others? You know, how can I help my clients? Because I'm seeing too many that are on 10 years, or at least more than 8 weeks. This tablet should be only for short term. As you can see, the research shows us up to 4 weeks. And you can also see here that it needs to be reviewed 4 weeks, 12 weeks, 6 to 12 months. But I am seeing too many on it. Like long term, more than 12 months. And that's scary. They're not telling you, they don't know what to do, they don't have a plan themselves. This can be really dangerous if you use long term, because it, as much as very, very effective in reducing the gastric acid, but it has a consequence. And the consequence is like this: gut infections. So there will be some bacterial overgrowth, some fungal overgrowth, and that then gives a ripple effect that will give you some bone fractures in the future, nutritional deficiency. Another one is magnesium, low in magnesium, or it can cause some cognitive dysfunction. So it's worrying.
We've got big news on the Obamacare funding front. Marjorie Taylor Greene, who is a huge MAGA member of Congress, Republican from the House, Trump's biggest defender, has caved and said we need to fund the Obamacare, the ACA, the Affordable Care Act subsidies, and fund them now. This is what Democrats have been demanding. This is why the government was shut down, because Republicans wouldn't fund it, among other reasons. And for her to admit it, she said, my kids' premiums are going to double if we don't fix this. And I don't like Obamacare, she said, but I don't want the premiums to double. That's ridiculous. She's admitting what Democrats are saying is true. The premiums will double unless the Republicans fix this. She's also admitting that Democrats are, this whole shutdown, this whole issue of what Democrats are asking for is to fix the subsidies. It's not to help illegals. It's to help people like Marjorie Taylor Greene's kids. She's admitting it. This is a big deal, guys. She's a wacko. This is the one who claimed that Jews had space lasers in space that were starting forest fires. She's crazy. For her to come along as such a huge Trumper is a huge deal. It also explains why they're out of session this week and why they're on vacation, because the House Speaker, the Republican, didn't want them here because he was...
And we close with peak irony. Marjorie Taylor Greene, the socialism is evil warrior, just begged Congress to fund ACA subsidies. Why? Her kids' premiums are doubling. She's asking for the exact thing she's been blocking, the thing she called communism last month, because now it affects her family. Suddenly, it's not socialism, it's fixing the system. This is the playbook, gut healthcare, until you need it. Then demand the bailout. And yeah, we should help, because healthcare is a right. But let's not forget, she created this crisis, and now she wants credit for solving it? We see you. So where does this leave us? With MAGA voters discovering what the rest of us knew all along, universal healthcare isn't socialism, it's survival. They spent years fighting against their own interests, defending insurance companies that robbed them, electing politicians who gutted their coverage. And now they want what they destroyed. The awakening is happening, the math is undeniable, the bills are piling up. So yeah, welcome to the fight for universal healthcare. You're late, but you're here. Drop your story below. When did you realize the system was broken? Smash that like, share this with someone still figuring it out, and subscribe. Because this conversation, it's just getting started.